A lot of my patients are very active, and they're always asking, hey, doc, when can I get back to CrossFit or cycling or jogging or crunches or yoga? Just so you know, everybody gets back to normal, all things going well. So you will eventually be able to do all of those things if you behave yourself in the immediate postoperative period. So one thing that is tough to get unless you do what I do every day and see these things is that there's a covering over the brain called the dura that holds water in. And in order to do a good surgery, we have to open that covering, albeit a small opening. It's still a watertight seal that we're opening. I've got to close that with sutures and some other materials. We got to get a watertight closure. Water will find its way through almost any little crack, especially if there's pressure put behind it. So abdominal crunches, yelling really loud, moving a couch, lifting wet laundry, these sort of things, bending over and tying things, or especially yoga, those sort of things increase the pressure on the repair, on the incision that's trying to repair. So I have a pretty strict rule. None of that stuff for 6 weeks. We say no heavy lifting, bending, or stretching for 6 weeks after the procedure. If my patients behave themselves and they really don't do that, after that time point, they're pretty much free to do whatever they want within reason. If they test it early and go back to CrossFit in 2 weeks, there's biological wound healing or incision healing that just hasn't happened yet. So you can threaten a watertight seal if you push on it too hard. Even though it's fine, if you push on it too hard in the first 6 weeks, you can cause a problem. So for me, no heavy lifting, bending, or stretching for 6 weeks. All other activities are basically normal. So I hope that helps. Again, everybody's specific. There's different things for everyone, but in general, it's a 6-week rule. If that doesn't totally answer your question, feel free to drop us a line or give us a call. We have a lot of other microvascular decompression questions answered in video format and in text format on the website. So check us out, drop us a line. I hope this helped.